It is World Mental Health Day, and we are marking it by taking a look at the growing popularity of psychedelics as an assist in therapy and as treatment for mental health conditions, including PTSD and depression. Now, there's been a shift in the doors of perception, you might say, the public perception around psychedelics. So consider this. In the past year, at least 19 states have thought about legislation to research psychedelics or to use it for medical purposes, including legalizing or decriminalizing psilocybin. Magic mushrooms I hardly knew ye, or other drugs like MDMA. Meanwhile, Colorado, Oregon, and New Mexico have passed legislation for their states. And by the way, our health secretary, Robert F. Kennedy Jr., has publicly supported clinical use of psychedelics to potentially help people with mental health problems. At a House committee hearing in June, Kennedy said the FDA is beefing up government-run clinical studies and working hard to bring more access to these treatments for veterans and others battling trauma within the year. That's the timeline. But safety questions remain about these drugs. To talk about this and more, Dr. Rachel Yehuda, who is the director of the Parsons Research Center for Psychedelic Healing at Mount Sinai, joins us. Doctor, thank you very much for being here. It's a very exciting time when it comes to this forefront of medicine, because it's been there all along, but it hasn't been looked at in this way. How are you feeling about things?
Oh, I'm feeling so optimistic about the future of psychedelics for mental health. There's still a lot more research that needs to be done, and we have to gear up in a way that makes it safe to be able to provide these therapies. We have to make sure therapists know how to use these medications, and also who should and shouldn't be treated with them.
So how do these medications help people who are struggling with mental health conditions, psilocybin and MDMA, for example?
Yeah, that's a really good question. I mean, the approach that we now have when people are suffering from things like depression, anxiety, and trauma is that we try to dampen the symptoms. Can't sleep, let's help you sleep. You're feeling depressed, let's make sure that you don't feel as depressed. But this is a very different approach. This is an approach where you take a medication that puts you in an altered state of consciousness. And if you are prepared for it in the right way and you do it in the right setting with the right facilitator, different kind of material will surface. Emotions, thoughts, memories, a lot of things that usually you spend a lot of time keeping down. But the reason that we have mental health symptoms is because we feel those things and because things have happened to us. So this is a way to access and be able to work with really what's at the core of the problem.
So those repressed memories will surface in the psychedelic state. A patient is still with a doctor the entire time, and do they then have a conversation to work those out?
I wouldn't call it a repressed memory. I would basically say that we try to organize our minds so that we can function. And when you have a very distressing thought or a very distressing experience, it's natural to try to put it in the back. Sometimes that works for a while, sometimes it doesn't. And sometimes things are happening in the here and now, but really they're connected to something that has happened in the past. And if your approach is, I'm feeling anxious, what can I do to reduce my anxiety? Or I'm feeling depressed, what can I do to dampen my symptoms? You may not reach those places, or you may have to do something continuous, like take a drug every day, and if you don't take it, boom, there those symptoms pop up again. So this is a way of taking a medication once or twice or 3 times at most. These are sessions that take several hours with psilocybin or MDMA, could be 6 or 8 hours. And you're with therapists the whole time, and stuff comes up that you talk about, and hopefully you won't have to keep taking medications once you try to get at the root of the problem.
So here's a conundrum for us. I know people who have taken these drugs have benefited. I know therapists who work with these drugs and patients in a professional practice. And yet when I talk about it, I still find the corner of my mouth lifting up, a little bit of a smile, because there's this history. There's Harvard and LSD and Timothy Leary. There's the Woodstock generation. Is that an obstacle to getting lawmakers to take this seriously and open the doors?
It is, but let's be very clear that there is a danger in having unfettered access to psychedelics and having people I wouldn't say danger. The drugs themselves are not very dangerous, but the material that can surface with these drugs can be very overwhelming. So you want to really make sure that you take the drug with a professional who is able to help you make meaning out of the experience that you've just had. For many people, what comes up can be very overwhelming, and if they don't have somebody there to talk them through it, then maybe some things can happen that would be harmful.
Yeah.
So there was a reason, perhaps, that people were a little bit nervous about these medications or these drugs.
Yeah.
They were drugs before, now we're trying to see that they
both,
can be
they're both,
medications.
yeah.
But so I think that really when we're talking about what's new in the field of mental health, we are not talking about handing somebody a psychedelic and saying, you know, let me know how it goes. We're talking about a supervised experience in the context.
That's important.
And the cutting edge, really, of what's possible now.
Yes.
Dr. Yehuda, this is fascinating. Thank you so much.
Thank you.
Thank you.
Really interesting.